Okay, so good day to every one of you. My name is Mr. Abasa Glory. So, thanks to everyone that made attempt. So, let's talk about the first question here. It says, the nurse hears other staff member talking in a crowded elevator about a client on the unit. The client is identified by name and detail of illness. The client is identified by name and detail of illness. Which action should the practical nurse take at this point? Which action should the practical nurse take at this point? What is the point? What is the question? Staff member are talking about a patient in a crowded environment. What should the nurse do at this point of discussion? What should the nurse do? You are in a place where other nurses are talking about a client in their ward, calling his name and all of that. What should you do at that point? That's what the question is saying. Number one, report the behavior to the head nurse. Meaning, are you going to leave the place and go and report the situation to the head nurse? Is that the right thing to do? Let's hold on. Number two, report the behavior if it happens again. Will you allow them to discuss the situation going on and then you watch them and wait for it to reoccur again before you report? Let's hold on and move on. Number three, interrupt the conversation in the elevator. Do you think interrupting the conversation in the elevator will stop the conversation? Let's move on. Hold on to that and move on. Speak to the staff member when he or she gets off the elevator. Speak to the staff member when he or she gets off the elevator. So are you supposed to wait till you leave the elevator before you talk to them or you speak to them that what they are doing is wrong? Would you wait till that time? That's the question you're going to ask yourself. So the question is, what will you do at this point right here and now? At this point right here and now, the best thing to do is to change the topic. Change the conversation. That's to say, interrupt the conversation. When you interrupt the conversation or change the conversation will end. So the right thing to do right here, right now, is to interrupt the conversation. So that's to say, interrupt the conversation so that they no more talk about the situation. However, after interrupting, the next thing you can do is to report if it happens again. That's to say, the order of priority: first, you interrupt; two, you speak to them after the elevator, and then you report if it happens again. First, interrupt. Two, speak to them after the elevator that you are doing is wrong. And then if it happens again, you report to the head nurse. So the answer to the number one question is 3. Interrupt the conversation in the elevator. Thank you. Okay, so good day to every one of you. My name is Mr. Abasa Glory. So let's move straight to number 2 question. Number 1, everybody got it, so it's a good one. So let's keep practicing. So number 2 says there is a train wreck causing 46 casualties. The nurse is asking personnel on the floor to suggest clients who could be discharged to make room for casualties. Which client should be best for the licensed practitioner nurse to suggest? Which client is best for the licensed practitioner nurse to suggest? Now, looking at the question again, it means that the casualty occur and then we need to remove some persons from the ward, creating room for others. Now, in answering question like this, there are rules. One of the rules says, when you are asked who to be discharged, the first rule is stable patient versus unstable patient. Stable patients versus unstable patient. When you say stable, who are those that are stable? Who are those that are unstable? That is the first question you're going to ask yourself. Among these patients, which of them are unstable? Which of them are stable? If all of them are stable, the next question you're going to ask yourself is, which of them, if discharged, does not have issues. That's to say, which of them will require maybe home visit, maybe can come for recheck or can come for dressing from home and there will not be any problem. Those that can come from home for dressing can go home, but those whom they need further treatment before they can be discharged are those that should stay behind. That is another method. First, I say you must check for stable versus unstable. If all of them are stable patients, the next thing is you need to now ask which of them require continuity of care and which of them can go home. If any of them can go home and come back for treatment in terms of dressing or whatever it is, such a patient should be discharged home. So let's go to the question and now ask ourselves again. The question says there is a train wreck causing 46 casualties. The nurse is asking personnel on the floor to suggest clients who could be discharged to make room for casualties. Which client would be best for the licensed practitioner nurse to suggest? A 77-year-old who had fractured femur with hip replacement yesterday. A 77-year-old who had fractured femur with hip replacement yesterday. B, or number 2, a 58-year-old who had open cholecystectomy 2 days ago. A 58-year-old who had an open cholecystectomy 2 days ago. 3, a 52-year-old who had a bowel resection with colostomy yesterday. A 52-year-old who had a bowel resection with colostomy yesterday. C or D, number 4, a 44-year-old who is undergoing internal radiation for cancer of the cervix. The question is, among all of these, which of them are unstable? Let's follow the first rule. A is stable, B is stable, C is stable, D is stable. So all of them are stable patients. Now the next question will not pass the test is, which of them can go home and come back for dressing, or which of them must stay behind for continuity of care? Now number 1 say a 77-year-old who had fractured femur with hip replacement yesterday. Somebody had fracture of the femur and had hip replacement yesterday. Such an individual cannot go home because he needs to be taught how to use crutches. He needs to be taught how immobilization, how to use the affected fracture bone, replacement hip and all of that. So number 1 need to stay behind for proper treatment. Number 2, a 58-year-old who had an open cholecystectomy 2 days ago. What is cholecystectomy? Cholecystectomy has to do with surgery of the gallbladder. This gallbladder. The question is this patient stable? Yes, it's stable. But can this patient go home and probably come back for dressing of the open wound? Let's hold on to it and go to the next one. Number 3, a 52-year-old who had bowel resection with colostomy yesterday. The individual is having normal bowel before, but suddenly he had bowel resection. Probably, maybe he had issue with bowel, issue with defecation, and in attempt to repair it, colostomy was done. What is colostomy? Colostomy is an opening to the colon, which acts as an artificial anus. If there is an anus issue, if there is cancer of the rectum, or if there is perforation of the rectum, and if there can no more defecate through the anus, the intestine is brought to the abdomen, the surface of the abdomen, through what we call colostomy. So colostomy was done yesterday. Somebody that had colostomy yesterday, can the person go home today? The answer is no. Why? Because the individual need to be taught how to care for the colostomy. The individual need to be taught how to care for the wound, how to care for colostomy bag, how to care for the type of diet to take and all of that. So number 3 has to stay behind because there is need for continuity of care. Number 4, a 44-year-old who is undergoing internal radiation for cancer of the cervix. Internal radiation is are more or less like they are dangerous. Radiation is dangerous, which means that somebody who is undergoing radiation can cause issues to other people because of that implant of the radiation is using, because radiation is one of the method of killing cancer cells. So number 4, need to be monitored, need to stay in the hospital, because allowing him to go home, the rays from the radiation can cause issue to other people. So number 1, number 3, number 4 require continuity of care, but number 2 can go home, come back for dressing of the open wound at the back. So that is for that. So the answer to the question is number 2. Thank you. Okay, so let's move on and go straight to number 3 question. Number 3 question says, an alert adult is being admitted for elective surgery. An alert adult is admitted for elective surgery. Which comment made by the client indicate a need for more instruction regarding advance directive? An alert adult is being admitted for his elective surgery. Which comment made by the client indicate a need for more instruction regarding advance directive? Now the question is, what is advance directive? An advance directive is an instruction that is given ahead of time on what to be done for a patient who may not be able to make decision for himself after treatment. Advance directive is an instruction given, is an authority given, is an instruction given by a patient before, either a patient or a family member, towards a client before going through a surgery or any kind of procedure, that after the procedure the patient may not be able to take such decision. Advance directive is what is used. Now the question is saying the client is alert, an alert adult. He is alert. 2, he's going for elective surgery. So it's not the type of surgery that will make him not be able to care for himself again after surgery. So that is it. So the 2 key statement is, 1 is alert, 2 is an elective surgery. So the question is this: which of the following statement, if made, indicate a need for more instruction? Which of the following statement that if he makes it, it means that he did not understand what advance directive means? Number 1, I brought a copy of the completed form with me. Is that a right statement? If a patient make a statement that the advance directive, I have brought a copy, is it a wrong statement? Let's hold on and move to the next one. I'm glad I don't have to make decision about my care anymore. I am glad I don't have to make decision about my care anymore. A patient who is alert, a patient who is going for elective surgery, and he makes a statement, is that the right statement? Does it mean the patient understand if he make this statement? Let's hold on. Number 3, my husband is the one who gets to make decision for me. A woman who is going for elective surgery is saying, my husband will want to make decision for me. Is that the right answer? So let's hold on and go to the last one. My child have all copies of my living will. Is that the right statement to be made? For somebody, if a patient make this statement, doesn't mean she understand the statement, what advanced will mean, advanced directive mean. So looking at the options, the question says the client is alert. 2, is going for elective surgery. So which means that it's not a surgery that will make him not able to care for himself. However, number 1 says, I brought a copy. Bringing a copy for the surgery, a copy of the advanced directive is a right procedure. So which means it does not have issues. Number 1 is okay. Number 2, I'm glad I don't have to make decision about my care anymore. Let's hold on to number 2 and go on. Number 3, my husband is the one who get to make decision for me. Advance directive. The patient is alert, very much alert. So the husband cannot make decision for him anymore. Cannot make decision for him at this time. 4, my children will have all the copies of my living will. So number 1, number 3, number 4, even though they are good, but they don't address the issue. So the statement of her saying, I am glad I don't have to make decision about my care anymore, becomes a wrong statement. Reason being that 1, she is alert. So long the patient is still alert, she has to still be part of the decision to be made. So number 2 become the best answer. My husband is the one to get to make decision for me is wrong. So long she is still alert, the husband cannot make decision for her. 2, my children have all the copies of my living will. Yes, children can have copies of her living will, but it has nothing to do with the question we are talking about. So answer to the question is 2. Thank you.